A lot of my work, academic work, is on compassion. I became a Buddhist monk briefly in a monastery that specializes in compassion. I think compassion is one of the most important, or the most important thing we need to develop as humans. Mm. But despite that, I know that there are times when I'm not compassionate. Again, because that's not our natural default constant setting.
Yeah.
So I end up doing practices, daily rituals to remind me. It's nothing different from, you're a doctor, and probably not your generation, but during my generation, sanitizing and hand washing was not done all the time. We did it, but not as frequent as now. And in younger doctors, it's automatic. Before you see a patient, you sanitize. We were not doing that before. So how did that become part of our habit and our nature? It's through daily practice, daily reminders. So just 1 second. So for compassion, we need daily reminders as well. So in my case, I meditate every day. And after I meditate, I always tell myself, may my mindfulness practice benefit myself as well as other people. So there's that reminder, okay, I'm doing this because it will benefit me, but I hope it also benefits other people. And then in the clinics, when I see patients, I have little reminders, little cues about compassion. So I have this orange wristband, which actually says to be of benefit. Once I don't wear it all the time because I will habituate to it. I get used to it. So once in a while, I don't wear it. And when I see this wristband and I'm dealing with a particularly difficult person, it's a reminder, Tony, it's a very difficult person, but you can still be of benefit. And then when I'm dealing with a difficult person, so this is actually in practice. So this is another tip. When you're dealing with a difficult person, difficult patient, difficult family member, or difficult person in your bubble, is to remember that the person is difficult, most probably because they're suffering. Yeah. If they're not suffering, most probably they're not difficult. So that's a common thing I do. So I do this mental gymnastics. I don't need to train myself to be kinder and be more compassionate to my nice patients because it flows. It flows. I don't need to train myself to be compassionate to my mother. It just flows. Well, I have a nice mother. But it's when you encounter annoying folks, people who are different from your values, people who who are just out of this world, the natural tendency is to switch off. Yeah. So being conscious of those moments when we're encountering strong negative emotions towards others. And that's where mindfulness actually comes in. With mindfulness practice, people become more in tune with their experiences. So they're feeling anxious, they're feeling annoyed, they notice it. For some people, they don't notice it until it explodes. So when you're more mindful, you're more in tune with your body, you notice, oh, I'm starting to get annoyed with this person. And then now I have a choice. Do I feed the annoyance or act unhealthily? Or do I make a choice? Tony, you're getting annoyed with this person, and that's all right. She's annoying, but she's suffering, and you're suffering. And then I consciously think that, no, I can be of benefit to this person. So all sorts of techniques to enhance compassion, from having that motivation to be of benefit, thinking that we're actually all the same, really. Superficially, we look different, but deep inside, we're, pretty much the same. Yeah. And then it's easier for compassion to flow.